Hello, my name is Blair Creekmore. I'm an RN in IBCLC. Today we're going to be talking about breastfeeding self-efficacy and LATCH assessment. It has been said that breastfeeding is 90% determination and 10% milk production. Typically, as nurses dealing with moms who are breastfeeding their babies, we tend to focus on that milk production. We want to make sure the baby is being fed. But when you talk to new moms and they ask what are their concerns, breastfeeding is one of the top three, along with lack of sleep and the overwhelming demands of being a mother. Nurses who work in a breastfeeding-friendly hospitals are in a great position to help reduce mom's anxiety by supporting breastfeeding and increasing in her determination. Successful breastfeeding occurs when three different dynamics come into play. One of them is lactation education of not only the mom, but the significant others that will be supporting the mother. Another is lactation support. Now, the support can either come through the nurses who are caring for the mom or through the IBCLCs who are working in the hospital. The third component that aids in breastfeeding success is moms who have a high self-efficacy regarding breastfeeding. Since breastfeeding self-efficacy is considered one of the three main components for breastfeeding success, let's look at what the definition of self-efficacy means. Dr. Cindy Lee Dennis at IBCLC defined breastfeeding self-efficacy as mom's confident in her ability to exclusively breastfeed her baby and her confidence in her ability to overcome breastfeeding challenges. As you can see in this definition, it's really a two-part process. One is her confidence in her ability, and that ability does include whether or not her body is able to produce enough milk for her to feed her baby. But it also includes her confidence in her ability to overcome breastfeeding challenges. And this is an area where nurses and IBCLCs can intervene and increase her self-efficacy. Why is breastfeeding self-efficacy so important? Well, Dr. Cindy Lee Dennis also found that breastfeeding self-efficacy will predict whether a mother chooses to breastfeed or not to breastfeed her baby, how much effort she will expend in the breastfeeding process, whether she will have self-enhancing or self-defeating thought patterns, and how she will emotionally respond to breastfeeding difficulties. All of these components will impact the mother's breastfeeding experience. Studies have also shown that there's a correlation between high breastfeeding self-efficacy at 2 days postpartum and breastfeeding at 6 weeks and 6 months. There's also a correlation between high breastfeeding self-efficacy at 2 days postpartum and lower depression scores at 6 weeks. This is important to remember because at 2 days postpartum, the mothers are still in the hospital, where nurses and IBCLCs can have an influence over her breastfeeding decisions and provide evidence-based education that she needs. As you can see from the tricore breastfeeding model, the mother-baby dyad is influenced by self-efficacy, lactation support, and lactation education. These three things are further enhanced when the mother delivers in a breastfeeding-friendly hospital. Within a breastfeeding-friendly hospital, you've got access to lactation support that can help mom overcome any challenge that she might have. You also have access to evidence-based lactation education, which the mom can be assured that she's receiving current information. Also, self-efficacy is a component. This is an area where nurses, as we have said, can have the most influence and the most impact on the mother-baby dyad. Now that we established that one of our goals is to increase mothers' breastfeeding self-efficacy, we need to determine what is the nurse's role. The nurse is in a primary place to provide support and education for the mother. In order to do that, she needs to have proper assessment of what's going on. First, she needs to assess the breast. Then she needs to also assess the feeding accurately using the LATCH score tool. We need to partner with the mom with an attitude of compassion using motivational interviewing techniques, which we will discuss later. We also need to determine the stage of change and where she is along the change theory. And then finally, we need to initiate self-efficacy breastfeeding strategies that will affect mom and baby. Breastfeeding assessment first begins with assessing the breast. What is the nurse looking for? She's looking to see if there's anything that could affect breastfeeding. The mom may or may not be aware that these things can affect breastfeeding, so you cannot necessarily rely on her to provide some information. And this is where some open-ended questions will come into play. But in initial physical assessment, you want to look for things such as flat nipples or inverted nipples, nipple piercing, scars from biopsy and surgery. Has she had a breast augmentation or breast reduction? Or is there breast symmetry or asymmetry? Now, I'm not saying that all of these things will cause problems with breastfeeding or that they will prevent the mom from being able to breastfeed her baby. But what I am saying that these things may be a red flag that, hey, we may need to make sure we're monitoring the breastfeeding experience between the mom and the baby real closely to make sure the baby is effectively able to transfer milk and that the mom is comfortable with her breastfeeding experience. One of the tools that we have available is the LATCH score table. The LATCH score table allows the nurse to evaluate the breastfeeding experience that she observes or the mom reports. LATCH, audible swaddle, type of nipple, comfort, and hold are all evaluated on a scale of 0 to 2, depending on where they fall on the table. But what we've done is added some questions here to help you further with your assessment and also added some interventions and tips that will help move that mom or baby from a 0 to a 2 on the table. The goal here is to use this as an assessment tool that is a launching pad for your nursing interventions and evaluation as part of the nursing process. Some of the tools the nurses can utilize to increase breastfeeding self-efficacy and our assessment process is some motivational interviewing techniques. One of the things is to come to mother with a motivational attitude of partnership, acceptance, compassion, and advocacy. We need to realize that some of the best ideas can come from mom. We also can utilize OARS as part of our assessment process. OARS is an acronym for open-ended questions, affirmations, reflections, and summaries. By asking open-ended questions, we're allowing the mom to provide more information. Affirmations give us a chance to build up her self-confidence and self-efficacy. Reflections will allow for the client to understand that we are think and feel along with her. In summary, it provides an opportunity for us to summarize what the client conveys and plans for change. Our goal is to engage the client, to help her to focus in while using the OARS to develop and set her goals, and we want her to evoke some change talk. We want to hear those statements of I won't and I will. And then finally, we want to help in the planning of her breastfeeding goals. Finally, the nurse needs to assess what stage of change the client or the patient may be in regarding her breastfeeding experience with her baby. Most mothers that come in have already decided whether or not they want to try breastfeeding. They're probably in the contemplation or may even be in the preparation stage of change. They say, I may want to try or that I will try. And these are some of the statements that you're going to hear her say. Our goal here is to get her into the action phase where she's actually making the change or she is actually doing or she is actually breastfeeding her baby effectively. So what we want to do as nurses is to elicit as much change talk as we can. We want to convert some of those I can't to I can or I won't to I will statements. Just because she may have resistance during this phase does not mean that she does not want to or that she is in the no, not me phase. A lot of times you take 2 steps forwards and 1 step back. And as his nurses is coming along and partnering is to help her to progress along these levels of change. Finally, the nurse needs to initiate some breastfeeding self-efficacy strategies. Because what is our ultimate goal? Our ultimate goal is to increase mom's confidence in her ability to exclusively breastfeed her baby. There have been several strategies that have been identified which can help her mom to accomplish this goal. They are to provide guidance, involve partners, family, and education and support, avoid ineffective support and conflicting information, support the mom in whatever decisions that she makes, and finally to identify potential barriers to breastfeeding and to access community support as the mom may or may not need. This may be a lot to remember when you're assessing the mother and the baby and the breastfeeding experience. And because of that, we've combined everything together into a breastfeeding self-efficacy tool, which will help you to remember the concepts of PACE, OARS, determining the stage of change, and the self-efficacy strategies that increase mom's confidence in her ability to exclusively breastfeed her baby. Now we're going to look at some breastfeeding scenarios. Look at the following pictures and discuss in light of the following questions. You can use the LATCH score with the questions and interventions along with the motivational interviewing tool that increases breastfeeding self-efficacy. What you want to look for is what is the LATCH score, what further assessment is needed, what education intervention is needed to improve LATCH score and breastfeeding self-efficacy, and what breastfeeding self-efficacy strategies would you initiate. Not everyone may have the same answers to these questions, but it's a good chance to see what some ideas that are out there. Because again, we're going to be discussing all these with our clients and with our patients, and they may or may have some ideas that we hadn't thought of as well. Breastfeeding scenario number 1. The nurse is called to the room by mom. Mom states she has baby latched on, but is not sure if it is correct. Mom states baby latched easily, but is now fallen asleep at the breast. Mom states she feels no discomfort with latch. Earlier you had observed that mom does not have flat or inverted nipples. With this feeding, you notice that baby's suck increases to rhythmic suck with audible swallows when stimulated. How would you score this feeding? What questions would you ask, and what interventions and education would you include in your care plan for this mom? As you can see, we gave the mom a latch score of 7. For the latch, we scored her a 1 because the baby does need stimulation to suck. Under audible swallow, the mom and the baby received a 1 because the baby needs stimulation, but the audible swallows are present. As far as the type of nipple, we scored a 2 because of the previous assessment showed that her nipples were not flat or inverted. Comfort, the mom receives a 2 because she reports no tenderness. However, this may change if baby continues to latch as in the picture. As far as hold, we gave the mom a 1 because mom is able to get the baby to latch, but she is requesting assistance. So the nurse is probably a good idea to be there for the next feeding. As far as education and interventions that may be initiated for this mother and this baby, one would be including some education regarding proper positioning. As you can see, the baby has kind of grabbed hold of the nipple and has got his head tilted back, which is probably going to be making the mom more uncomfortable if this continues. So we probably want to talk to her about positioning so that the baby's looking directly at the breast and not twisting the nipple up. And you may want to talk to her about early hunger cues and ways to wake a sleeping baby as well. But overall, some good affirmations that we can give to this mom is that she does have the baby positioned where one hand is on each side of the breast, and the baby is actually exchanging milk from her to the baby, because we are hearing those audible swallows. And you also want to give her kudos for giving it a try. Breastfeeding scenario number 2. Mom calls you in for assisting with breastfeeding. Baby is fussy and mom is having difficulty supporting baby's head. You assist her with supporting baby in football hold. Baby latches with lips flange, rhythmic suck, and audible swallow. Mom reports no discomfort with latch. What do you score this feeding? What education or nursing interventions would you recommend, and what questions do you ask? We actually gave this mom a good latch score of 9. She received a 2 for lips flanged, rhythmic suck and grasp the breast. Audible swallow was a 2. Type of nipple, we put down a 2, but we'll need further assessment. It's not mentioned in the narrative, and you cannot observe it. But the mom reports no discomfort with the latch. We did give her 1 because she did require full assist, but then the mom took over. Some further education interventions for this mom would be to reinforce the education that she's already received as far as proper positioning. And obviously the mom is doing good. She just needs a little bit more self-confidence in her own ability to breastfeed her baby. So this will be a good chance to intervene with some of those self-efficacy breastfeeding strategies that we had mentioned earlier. You may want to include the family in supporting on her and giving her some affirmations of what she is doing well, because she's obviously doing a lot of things well. So we just need to assure her that yes, she can do this on her own. And it'll be a good opportunity to talk to her to see what type of support she would like to receive when she returns home. Breastfeeding scenario number 3. The nurse enters the room just as baby is releasing from the breast. When baby releases, you notice the following on mom's nipple. See the picture. Mom states that baby is sucking rhythmically, but pops on and off the breast. Mom is using a football hold and reports that she is holding breast and nipple for baby to maintain the latch. Mom reports hearing swallows, but they are not consistent. Mom states breastfeeding is painful, but she thought that was normal. What questions would you ask mom? What education or interventions would you address? And what LATCH score would you give this feeding? Well, this mom has a lot of things going on. We actually gave her a LATCH score of 4 for the following reasons. Under LATCH, she scored a 1 because she's able to maintain the breast hold and the baby is popping on and off. Under audible swallow, we received a score of a 1 because the swallows are not consistent. According to the picture, her nipples are everted, so she was scored a 2 under type of nipple. As far as comfort, we gave her a score of 0 because there's evidence of bleeding and mom states latch is painful. As far as whole, we gave her a 0 because although mom did not ask for help due to other assessments that are going along, the baby is obviously not latching well or correctly, so we scored a 0 until staff can observe the feeding. Otherwise, it looks like everything is going fine. This scenario is going to need further assessments. You may want to assess the baby for a tight frenulum. The damage in this picture was actually caused by a baby with a tight frenulum. It can also occur when there's a shallow latch. So you may want to make sure that the baby doesn't have a tight frenulum, and if he or she does, then a pediatrician may need to be consulted. Regardless, you want to schedule to come back when the baby is feeding to observe the feeding. Also, education is needed to let the mom know that bleeding and painful latch is not normal. And this is where some of those motivational interviewing techniques will come into play. We need to affirm her and give her support that, hey, she is actually attempting to breastfeed despite this pain and discomfort. But at the same time, we need to educate her on proper latch, proper positioning and hold. And then we also want to probably give her some ointment and hydrogels or some other interventions to make the latch less painful. She may need to have a pump so she can provide breast milk for her baby until her breasts heal up a little bit more. An IBCLC consult is also recommended, and also you may need to teach the mom some hand expression because we still need to feed the baby until the mom feels comfortable and is not in pain when she feeds her baby. Breastfeeding scenario number 4. Mom calls you in to assist with feeding. When you enter the room, you observe the following. See the picture. Mom states she's been trying to get baby to latch for a while, and baby's fussy and will not latch, but for a few brief sucks. Mom states she is supporting her breast and is able to express milk, which baby licks from her breast. How would you score this feeding? What questions would you ask mom? What assessments or nursing interventions would you initiate? And what would you add to the nursing care plan? This is another mom who is giving it her best effort to breastfeed her baby. But unfortunately, the mother and her baby are just not able to get things going off to a good start. We have given her a LATCH score of 3. Under LATCH, the baby received a 0 because although the mom reports repeated attempts, she also reports that the baby's licking milk and latches for a few brief sucks, but really is not latching on at all. Under audible swallow, the baby is not latching, so there is no audible swallow, although I'm sure the baby is swallowing what he or she is licking. Under type of nipple, we put a 1, because looking at the picture, she has flat nipples or short nipples. Comfort is a 2. The nipple appears to be intact, and there's no mention of a comfort level with those few brief sucks that the baby had, but there is need to further question the mom regarding her comfort level. As far as a hold, we gave a 0. Mom is obviously asking for help, although she does have some good things going on with this picture, and some of those we'll address with the next slide. As you can see, there's a lot going on in this picture. There's a lot of things that are not good, but there are some things that are good, and these are the things that we can focus on and build a foundation for this mom to have a successful breastfeeding experience with her baby. She is doing skin to skin with the baby, which is a very positive thing as far as starting out for breastfeeding. However, she is lying down in this picture, and that may not be the best position for someone with flat or inverted nipples. We may need to have her sit up and try different holds, such as a football hold, that may cause her breast to stick out a little bit more for the baby to latch on. We need to further assess her nipples for reaction when stimulating. She may need a nipple shield or a pump to pull her nipples out, or just supporting the breast while the baby's trying to latch. Education is going to be needed regarding hand massage or using the pump that we give her. On the use of the nipple shield. She's going to need to know how to effectively use all of this different breastfeeding equipment that we may need to add into this mother-baby dyad. We definitely want to observe the next feeding, and we want to be there early before the baby is too tired and fussy. As you can see in this picture, mom has been trying for a while to get him or her on, and little forehead is wrinkled, the baby's not happy, face is all grimaced up. These are all facial cues that the baby is stressed. So we need to calm that baby down. We do need to get that baby some milk and calm the baby so the baby is ready for the next feeding. The IBCLC consult will be recommended. At this time, it will be a good chance to intervene with some of the motivational interviews and the ORS interventions that we mentioned, as far as open-ended questions. Let's see what the mom thinks is going well, or why this is not going well. Is this a one-time thing, or has this been happening with every single feeding? And see her viewpoint. Ask the mom what her suggestions are, or what she has tried. Let her know that you're working with her and that you're not coming at her as the all-knowing person trying to intervene in this situation. She may have something that does work and is very effective in getting the baby to latch on. Also, you want to engage her, and we definitely want to have a plan. So the reflection and summarizing techniques are going to become very vital in dealing with this mother, because we want to be able to have a plan that she can go home and she is breastfeeding her baby, whether it's with a shield or pumping and putting milk in the bottle or pumping and cup feeding the baby, or whatever it is, to be able to provide breast milk for the baby that correlates with the plan and goals that she has for the baby. And she needs to know that we are coming alongside her to support her in whatever that decision is. We definitely want to bring in some of the breastfeeding self-efficacy items, such as involving family and support, community support, educating her and making sure that her education, she understands what she's doing. This is a mom that may have a few challenges to overcome, but before you know it, we'll be able to move her into the action and maintenance phase of breastfeeding. As you can see, breastfeeding support comes in all shapes and sizes. Us as nurses are in a prime position to provide information and support that will increase mom's breastfeeding self-efficacy, along with providing her evidence-based education and IBCLC support. The goal here is to be able to encourage the mom so that she can have a positive breastfeeding experience between her and the baby. Even a toddler is able to give the mom support that she needs, and as well as the baby, saying, "You're doing a good job, Mom. Let's keep it up." The next two slides are post-test. The first slide deals with breastfeeding self-efficacy, and the second slide deals with the LATCH score assessment tool. You can use the breastfeeding self-efficacy tool that we provided, as well as the LATCH score assessment tool, in order to answer the questions. We encourage you also to discuss among yourselves. It'll be a great opportunity to determine some examples of open-ended questions, examples of affirmation, examples of statements of reflection. All of these things we can also learn and feed off of each other. Enjoy, and I hope this has been a learning experience for all.